Next, we have B for border irregularity. This refers to the edges of the mole or lesion. In a normal benign mole, the borders should be smooth, even, and well-defined. But in melanoma, the border is often irregular, notched, blurred, or scalloped, somewhat wavy. The clinical insight here is that irregular borders indicate that the melanocytes, which again, the pigment cells in our skin, may be growing in a disorganized or invasive pattern, which is, again, characteristics of malignant behavior. If the edge of a mole looks uneven or fades into surrounding skin, it is somewhat of a red flag that warrants closer examination, monitoring, or biopsy. Then, next one, we have C for color variation. This means that the mole or lesion contains multiple colors or uneven pigmentation. A benign mole, non-cancerous mole, it usually has one uniform color, typically light to dark brown, but a suspicious lesion, especially melanoma, may show different shades of brown or black, or areas of red, white, pink, gray, even blue, or just uneven distribution of color across the whole mole. The clinical interpretation here is this. Color variation suggests that the melanocytes are behaving abnormally and producing pigment in an uncontrolled and chaotic way. And this heterogeneity is a common sign of malignant transformation, and especially when color appear in patches or swirls. Those are irregular swirls within the same lesion, and we can see it well under the dermoscope, which is a little device that we use for mole checks. Then we have D, that stands for diameter, larger than 6 millimeters. This refers to the size of the mole or a lesion. While benign moles are usually small, a warning sign for melanoma is a diameter larger than 6 millimeters, about the size of a pencil eraser. But here's something important. Melanomas can be smaller than 6 millimeters, especially in early stages. In fact, the smallest melanoma that I diagnosed at my clinic was 1 millimeter, which was literally a dot. So size alone isn't diagnostic, but when combined with asymmetry, irregularity, borders, or color variation, a larger diameter raises concern. The clinical insight here is straightforward, of course. Larger lesions are more likely to have undergone genetic changes that drive, again, uncontrolled growth. Measuring diameter is a simple screening tool and could be incredibly helpful in monitoring moles.